Buenos dias, good morning, and thank you for joining us today. My name is Ana Aleman, and I am the Regional Director of the Texas Border with Children at Risk. I am excited to welcome you to our annual State of Latinx Children in America Summit. For those that are new, Children at Risk is a research and advocacy nonprofit leading the way in improving the quality of life for Texas children. Children at Risk considers the whole child by tracking issues in health, safety, education, and economic security. Committed to action beyond the data, Children at Risk drives evidence-based change by speaking out on behalf of children. You can view the agenda for today's program and get to know our featured experts using the links dropped in the chat. If you have questions, please submit those for our speakers using the Q&A function. After the event, all registrants will receive the slide deck and any resources shared as the link to watch the video. Before we jump in, I'd like to take a moment to thank the folks who made today possible. First and foremost, let's give a shout out to our generous and engaged sponsors, Amazon and Amerigroup. But last but not least, we can't forget to recognize our community partners. Thank you, Fidelity and the Texas Family Leadership Council, for your continued partnership in our work over the years. I am pleased to introduce our first speaker of the day, Dr. Bob Sanborn, President and CEO of Children at Risk. Dr. Sanborn was unable to join us today for the live event, but he still wanted to share his support for the Latinx community. And let's hear Dr. Bob's remarks.
Part of our population. Sanborn, buenos dias, and welcome to our State of Latinx Children. We're really excited about the day because we have a lot of great speakers. We have a lot of really good information. We like doing this, and this is the second time we've done the State of Latinx Children, because this is a growing part of our population. Well over 50% in the state of Texas of all of our children are Latino children. Yet we still see that many of these children have obstacles in front of them in terms of success. Not as many good schools available to them, not as many health facilities with quality medical care available to these same children, just all around many obstacles to the success of Latino children in our country. So we want to try to answer some of those questions today, and we want to try to provide solutions. So again, we have great content. And then hopefully after you've spent your day with us, your couple of hours with us at this summit, you'll have an idea of how we might better serve the Latino children, the growing Latino portion of our population in the United States. We hope you have a good day. Enjoy. Bob Sanborn.
Thanks, Dr. Bob. And to kick off the content of today's event, we'd first like to set the stage and overview the data of who we are talking about. Let's begin with a look to the landscape and the state of Latinx children and their families in the US. We're going to move through these pretty quickly, but registrants will receive a copy of the slides shared today. So don't worry about taking detailed notes. Delivering this presentation is Sharon Watkins Jones, the Chief Equity Officer at Children at Risk. Sharon, will you join me on camera?
Hi, Anna. Thank you so much. So for Children at Risk and all of you as advocates for equity, knowledge is power, and data is the key to challenging stereotypes, myth busting, and data drives the effort to make change for the better. So to frame our conversations for the day, let's take a quick deep dive into research that sets the stage for us. Next slide, please. First, we'll take a look at the profile of Latinx in the United States. So 62.5 million people that are residing in the US are Latinx as of 2021. and 80% of Latinx residents in the US are citizens. That's a 2021. So the population skews young. The median age of Latinx in the United States is 29.5. So it's vital that we're having this discussion today with so many youth. Next slide. All right, let's take a look at the Latin American population and growth centers. These are pretty small, and as Anna said, that you will be receiving these. But when you take a look at these, there are significant differences at the state level. So in Texas, for example, 85% of Latinx children are of Mexican descent, while in New York, children of families from Puerto Rico and the Dominican Republic make up more than half of the Latino child population. Next slide, please. All right, let's take a look at Latinx families. So 95% of Latinx children in the United States are citizens, and about half live in mixed status families. And children living in this is defined as children who are living in families where the kids themselves are citizens, but one or more parent may not be a United States citizen. Next slide. All right, in terms of language, 70% of foreign-born Latinos ages 5 and up speak English proficiently. 91% of United States-born Latinos ages 5 and up speak English proficiently. 13.2% of Americans aged 5 and up speak Spanish at home. And on this topic, when we talk about myth busting, it's important to note that in Mexico, the government recognizes 68 national languages, 63 of which are indigenous. So you can't make a lot of assumptions there. All right, next slide. Okay, let's take a deep dive into health. Hispanic people in the United States have a higher life expectancy at birth than non-Hispanic white counterparts. Children ages 6 to 11 and 2 through 5 are 2 times and 4 times as likely to be obese than their non-white peers, respectively. And Hispanic men die by suicide at a higher rate than non-Hispanic white males. So it's, when you look at the graph in the right-hand lower corner, it's daunting to think of the uninsured rates for the non-elderly population by race and ethnicity is pretty high for those of Hispanic origin. Next slide. Okay, about 2/3 of Hispanic immigrants prefer to see a Hispanic or Spanish-speaking healthcare provider. However, less than 6% of physicians and less than 5% of psychologists identify as Spanish speakers. And this is compounded by 53% of Hispanic adults saying that health risk and jobs are a major reason for generally worse health outcomes. Now, for some outcomes, immigrants of other racial ethnic groups also have been shown to exhibit better health than their United States-born counterparts. When you receive this, you'll be able to take a closer look at that chart on the right. Next slide. Okay, this is extremely timely in this era of, as we're coming out of a COVID-19 pandemic. Latinx people are 1.7 times more likely to contract COVID-19 than their non-Hispanic counterparts, and hospitalizations are 4.1 times more likely, and deaths are 2.8 times more likely. Additionally, Latinx women are overrepresented in industries that are hardest hit by COVID, i.e. the service industries. Again, the uninsurance rates for Latino children are quite high. Next slide. When it comes to mental health, Hispanic youths experience higher rates of depressive symptomatology coupled with higher rates of alcoholism. And despite this, Hispanic communities have inadequate access to mental health care. The role of family and cohesion may be protective against certain mental health issues, but in the same vein, this can be a limiting factor in mental health. And most of us, regardless of culture, can identify with the fact that when it comes to mental health, a lot of family attitudes is to keep that sort of thing in-house and not to seek treatment due to stigma. Let's talk about education. Latinos currently make up 25% of school children. By 2020, 90% of Hispanic people between 25 and 29 years old have completed at least high school, which is up from 69% in 2010. Nearly half of United States Latinx students are the first to go to college in their families. 3.8 million students are native Spanish speakers that are not proficient in English. 45% of DACA recipients are currently enrolled in school or college, and 65% of DACA recipients graduate from high school each year. It's important to note that Hispanic students' dropout rate is 65% higher than non-Hispanic white students and 40% higher than Black students. Next slide. Finally, we'll talk about economic justice today. 15% of the Latino population live in poverty. 8.2% of non-Hispanic white population live in poverty. From 2009 to 2021, Latinx childhood poverty rates fell from 29.1% to 8.4%, which is the most out of all minorities. About 48.4% of Latinx households own their own homes. If the United States Latinx market was its own country, it would be the 8th largest economy in the world. It's also important to note that 91% of all DACA recipients are currently employed, 93% for recipients that are older than 25 years old. So talk about myth busting, that's a good statistic to hold on to right there. Last slide. Latinas still only make 57.3% of what non-Hispanic white men make. Latinas have the lowest earning of any major race, ethnicity, and gender. The median household net worth for Hispanic families in the United States is $36,100. White families having the highest median net worth at $188,000. So as you can see, as we continue this conversation today, there's work to be done. There are some things to celebrate, but there's a lot of work that we all must do to make sure that Latinx children have the best outcomes in life.
Thank you, Sharon. And with that, I'm excited to introduce our first speaker of the day. This presentation will look at the intersection of identity and the Latinx population and how the way we collect data plays a role in this. Presenting this information is Hugo Lopez, Director of Race and Ethnicity Research at Pew Research Center. As a reminder, you can learn more about our guest speakers today using the link dropped in the chat. And with that, Mark, the floor is yours.
Thank you, Anna, and thank you, Sharon, for the really great presentation. You really set the stage with a lot of great information about what we know about the nation's Latino population, where they live, the demographics of the group, and also some important trends that are emerging around Latinidad in the United States. I want to talk to you today about some of the work that we've been doing at the Pew Research Center that contains information about the ways in which Latinos are experiencing life, particularly the importance of skin color. If you've been following everything that's happening in Los Angeles, I think that some of what I'm going to talk about today, which is from a survey and a report we published in 2021, is going to provide some context for some of what we've been hearing coming out of Los Angeles recently around discrimination and even Latino on Latino discrimination. Next slide. I want to first tell you, though, about who we are at Pew Research, because I'm sure that there will be follow-up questions after my presentation, and I look forward to a conversation about things. But one of the things I think that's important to keep in mind is that the Pew Research Center is a nonpartisan, non-advocacy organization. We don't take any positions on policy, and we don't make any policy recommendations. In fact, we call ourselves a fact tank as opposed to a think tank, and that is on purpose because of those characteristics about who we are, being nonpartisan and non-advocacy. With that said, though, next slide, let me share with you some findings about our data. So first, as you know, the nation's Hispanic population has reached almost 63 million people. Now, this is a number that's probably an undercount of the nation's Hispanic population, partly because the 2020 census had an undercount of about 5% of the number of Latinos living in the United States. If you were to calculate that out and put the numbers here, you're probably seeing more of a population like 65 to 66 million Latinos living in the 50 US states and the District of Columbia. So keep in mind that these numbers, while important and growing fast, may be an undercount of the true size of the population. Next slide. And the importance of the Latino demographic to the nation's population overall can't be understated. This is just from 2010 to 2020. But as you can see, Latinos have accounted for half of the nation's population. They make up almost 1 in 5 Americans today, in fact. And this isn't new. This pattern of driving US population growth has been true since the 1990s. And so when we talk about the nation's changing demography, the nation's growing diversity, Latinos are a key part of that story. And so it's important to note as well that not only are they an important part of the national story, but at the local level, that dispersion of the nation's Hispanic population across the country is driving similar changes in just about every corner of the nation today. Next slide. One of the other interesting findings here from the 2020 census, though, is this question of race. And as you know, race, and particularly race among Latinos, has been a growing conversation over the last few years, particularly after the killing of George Floyd. But even before then, a lot of conversation had been in place around Afro-Latinidad and what it means to be indigenous, in addition to just being Latino in the United States. One interesting finding from the 2020 census is that a growing share of Latinos appear to indicate that they're multiracial, of 2 or more races. Now, some of this is the result of some coding decisions on the part of the census, but as you can see, the number of Latinos who are identified as being of 2 or more races grew to 20 million people in 2020, up from 3 million in 2010. There's a number of reasons for that, but the reason why I'm sharing this with you is that when we talk about race among Latinos, there are multiple dimensions to it, and this is only one way to think about it. Next slide. Speaking of Afro-Latinos, one of the big questions we get regularly at the Pew Research Center is about how the size of the nation's Afro-Latino population. At the Pew Research Center, we did a survey of US adults, asking them directly about whether or not they consider themselves to be Afro-Latino or Afro-Caribbean or Afro-Cubano, or if you name origin country. And we found that about 2% of all US adults, so 2% of the entire US adult population, consider themselves Afro-Latino. That adds up to about 6 million people. But we also found another very interesting finding, and this is, I think, one of the key takeaways from my talk, is that asking about identity can be shaped by the way in which you ask it and the context in which that is asked. And there's more to identity than just simply racial and ethnic identity. There's much more to it than just those 2 aspects. But in terms of the Afro-Latino population number, 6 million is our estimate of the size of the Afro-Latino adult population. But notice, about 800,000 of those Afro-Latinos also tell us that they're neither Hispanic nor Latino. In other words, they don't identify as part of the Hispanic/Latino/Latinx population, but they say that they are Afro-Latino. Most of those folks will identify their race as Black, by the way, whereas among those who self-identify as Hispanic, the single largest racial category among them is white. So interesting patterns in terms of racial identity, and also that not everybody who's Afro-Latino necessarily identifies as part of the Hispanic or the Latino population or Latinx population in the US. Next slide. Speaking of the origins of Latinos, as you know, the Latino population is diverse on many dimensions. I just wanted to share these numbers with you to put these in perspective. We talk about race, we talk about Hispanic identity, Latino identity, or Latinx identity, but there's also origin identity. And frankly, most Latinos in the United States today will prefer to identify by their origin as opposed to by race, or as opposed to even as Hispanic or Latino. Mexicans are the single largest group, but that share, that 59.5%, almost 60%, that share is in decline. Puerto Rican origin Hispanics make up about 10% of the population nationally, and that's followed by Salvadoran, Cuban, Dominican, all with at least 2 million people, and then Guatemalan, Colombian, Honduran, and Spanish, all with at least 1 million people. Now, interestingly, Cubans used to be number 3, but the most recent data from the Census Bureau suggests that the Cuban population has now been surpassed by the Salvadoran population. Now, we'll have to have a few more years of data to really make sure that that is the case. But as you can see, change is underway. Mexican share is in decline. Other groups are growing, and in fact, the fastest growing origin group among Latinos in the last 10 years has been Venezuelans. So just some things to keep in mind. Next slide. Now, I wanted to talk to you about some of our findings around skin color, because this is a really, I think, an important aspect of the Latino experience. Next slide. And this is based off of data of US Latino adults that we asked back in 2020. But as you can see, for US Latino adults, skin color is seen as an important part of the life experience. It shapes, they say, their life experiences. 62%, for example, told us that having a darker skin color hurts Latinos' ability to get ahead. 59% said, nearly the same share, by the way, that a lighter skin color helps Latinos' ability to get ahead in the United States today. 57% told us that skin color shapes their daily experiences, and half say discrimination based on race or skin color is a very big problem in the United States. Next slide. Also, when we talk about how it shapes their daily lives, you could see that, for example, darker skinned Latinos are more likely to say this is true than lighter skinned Latinos. And if one has had discrimination experiences, one's more likely to say that skin color shapes daily life experiences than those who did not have any discrimination experiences. There's a lot to unpack here, and I encourage you to take a look at the report, but I think it's an important pattern to keep in mind that skin color is related to views of how important skin color is in shaping daily life. Next slide. Across different groups of Latinos, whether men, women, whether immigrant or US born, whether young or old, no matter education levels, and even by political party, the importance of skin color in shaping the daily experience, life experiences of Latinos can't be understated. At least half of each of these groups, with the exception of Republicans, say that skin color shapes their daily life experiences. You can see younger people are slightly more likely than older Latinos to say this, for example, and those with college degrees or at least some college experience are more likely to say than those with less education. But notably, across all these groups, significant shares of not more than half say that skin color shapes daily life experience. So this is not just unique to darker skinned Latinos. This is something that is a common view held by various different parts of the nation's Latino population. Next slide. How does the impact of skin color compare to some other important factors in affecting the way people get ahead in the United States today? So in our survey, we asked about whether or not having a college degree helps, whether being in the country legally or not helps, whether being a man or a woman helps. And you can see where skin color rates here compared to other things. Certainly, legal status is seen as being, of all these things we asked about, the one that has the biggest impact of helping or hurting the ability of Latinos to get ahead in the country today. 88% say, for example, that living in the US without documentation hurts one's ability to be able to get ahead in the United States today. And if you are here legally, that 78% say that that helps. What about having a college degree? 82% say having a college degree helps Hispanics get ahead today. And 74% say that not having one can hurt. And you can also see, interestingly, for gender, that 52% say that being a man helps one get ahead in the country these days, whereas 44% say being a woman actually hurts the Hispanics' opportunities to get ahead in the country today. All this is interesting because skin color is seen as one of the biggest impediments or one of the biggest boosters for the ability of Latinos to either get ahead or not in the United States today. 59% say lighter skin color helps. 62% say a darker skin color hurts, and the ability of Latinos to be able to get ahead in the country today. Next slide. Our survey, just to give you some sense of this, was conducted online. It's bilingual and it's national. We surveyed almost 3,400 Hispanic adults from March 15th to 2021. This is drawn from 2 different panels, and it's something we've been doing regularly for our national survey of Latinos. So this is something we've had a lot of experience doing, but it is a nationally representative bilingual sample of Latino adults. Next slide. How do we ask about skin color? You might be wondering, how do we do this? This is how we asked about it. We asked people to self-assess their skin color. And here's the distribution of responses that we got. About 80% of Latinos will say that their skin color is somewhere between a scale of 1 to 4 on this scale. And 15% say that their skin color is somewhere between 5 to 10 on this scale. Now, we divided the sample up into 2 broad categories of lighter and darker skin. But as you can see, there is some pattern to this, and most Latinos are somewhere in 1, 2, or 3 in terms of how they self-assess their own skin color. But there is variation across Latinos in how they assess their skin color. Next slide. I want to talk a little bit about discrimination because this has been on the mind, I think, of a lot of people on Twitter, also in the press, particularly with everything that's been happening in Los Angeles recently. And here you can see that we asked about 8 different types of discrimination experiences. For example, People acted as if you were not smart. Somebody criticized you for speaking Spanish in public. Somebody told you to go back to your home country. You feared for your personal safety. You were called offensive names. You may have been unfairly stopped by the police. You heard. We also asked about whether you heard an expression of support. So trying to have something positive as well. But we directly also asked about whether you experienced discrimination by someone who is Hispanic and by someone who is not Hispanic. As you can see, there's a consistent pattern across all of these measures. Darker skinned Latinos are more likely than lighter skinned Latinos to say that they've experienced this in the 12 months prior to our survey. And it's interesting to note that no matter one's skin color, though, that all of these experiences are happening to Latinos across the board. So while darker skinned Latinos are more likely to experience these, on the other hand, lighter skinned Latinos are experiencing this to a certain degree as well. I want to point you, though, to the experience discrimination by someone who is Hispanic result, which is on the fourth line down. And you can see here that 27% of Latinos overall tell us that they'd experienced this in the past year. So discrimination from non-Latinos, 31% said that they'd experienced it, but from other Latinos, 27% said that they had experienced it, with darker skinned Latinos more likely to do so, to say this is true than lighter. There's a lot to absorb here, and I encourage you to go and look at the report and look at the slides, because there's a lot of interesting findings here around different types of experiences. You might find it interesting just to see how these responses vary. Next slide. Also, we've heard from Latinos in our survey that they're hearing Hispanic friends and family members make racially or racist and sensitive comments or jokes about other Hispanics. You can see that, for example, 13% said that they hear this often, 35% say sometimes, so it's almost half who are saying that at least sometimes they hear Hispanic family members or Hispanic friends make comments or jokes that are racist about other Hispanics. Darker skinned Latinos are slightly more likely than lighter skinned Latinos to say they hear this, but as you can see, it's pretty common for Latinos to say that they hear this. At least half are hearing it at least sometimes. Also, very similar pattern when it comes to racially insensitive comments about others who are not Hispanic. That too is a very interesting finding, and again, it echoes some of what we've been seeing happening in Los Angeles recently with the city council. Next slide. Also, Latinos talk a lot about skin color and race in their daily lives. You'll find that in our survey that about half of Latinos tell us that discrimination due to race or skin color comes up in conversations with family and friends at least sometimes. That race conversations about race relations and race come up in conversations with family and friends at least sometimes. And 8% of Latinos tell us that family talks to them when growing up about the challenges they might face because of their race or ethnicity. Another 19% said that happens sometimes, 25% said rarely, but about half said that never came up. So conversations about race and race relations are happening among many Latinos. But among Latinos from when they were growing up, half of them say that they never really heard from their parents or family members about the challenges they might face because of the race or ethnicity. So a mix of results here in terms of conversation. Next slide. Finally, how do Latinos feel about race relations in America? Next slide. We found that Latinos generally feel that there is, are split, when it comes to how much attention is paid to race and racial issues in the country today. 37% say too little, 25% say about the right amount, 6% say about too much. But you can see that there are some patterns. I direct your eyes to the very bottom of this table, where Latino Republicans are more likely than Latino Democrats to say that there is too much attention to race and racial issues in the country these days, 57% versus 27%. But Latino Democrats are much more likely to say than Latino Republicans that there's too little conversation around race and racial issues. Next slide. And when it comes to specific groups, Latinos feel that the conversation about race and Hispanics has been not as much as they would like. Half tell us that there's too little conversation nationally, too little attention, paid to this nationally when talking about race and race relations among Hispanics. Interestingly, though, when it comes to Black Americans, about 45% of Latinos tell us that there's actually too much conversation about race and racial issues in the country these days concerning Black Americans. And also, interestingly, with Asian people, Latinos feel that there is not enough conversation about race and racial So quite an interesting set of patterns here. But again, Latinos are feeling that perhaps there isn't as much conversation as they might like around race and racial issues as it pertains to Hispanics in the country today. Next slide. If you want to find our work, you can find us at pewresearch.org. Next slide. And you can also reach out to me here on Twitter. I'm at @Hugo_Lopez. And of course, you have my email here as well. I'm going to stop there. I want to say thank you for the opportunity to speak to you today, and I look forward to any questions you might have. And I hope you all have a great conference today. So thank you.
Mark, thank you for this informative look into the diversity and identity in our Latinx community, plus the role it plays in shaping our perception on challenges and solutions and how this influences policy. Colorism is definitely a topic of discussion in our communities, and I appreciate you bringing this difficult conversation to the forefront. And now I'd like to introduce our first session today on the state of children's health. Latinx children face unique challenges to healthcare, and this session will explore the disparities in access to medical care and outcomes, plus policies at the state, local, and federal level that can help provide support. Moderating this discussion is Esther Reyes, Director of Immigration, Policy, and Advocacy at Children's Defense Fund, Texas. Joining her for this conversation is Gabriela Barbosa, Managing Director of Policy at the Children's Partnership, and Dr. Carla Friedrichs, Assistant Professor of Pediatrics, Baylor College of Medicine, and Director of the Program for Immigrant and Refugee Child Health at Texas Children's Hospital. Would you all please join us on camera? And Esther, take it away.
Thank you so much, Anna, and thank you for inviting me to be here today to talk about these very important issues. I'm going to have some questions for our really great panelists. As you mentioned, we're going to be discussing the access, the disparities, and access to healthcare that pose challenges to our Latinx children. We know, of course, that overall Latinx children are more likely to be uninsured than their peers, even though a large majority of Latina children are U.S. citizens. We also know that having health coverage as a child has lifelong positive impacts, such as improved health, improved educational outcomes, and higher paying jobs in adulthood. One of the things that we're going to talk about today is the considerable variation in the Latinx child uninsured rate by state. We know that state policies play a key role in enhancing or limiting access to health coverage for Latino children. And we know also that federal policies, there are things that can be done at the federal level to remove some of these barriers and increase this access. So I want to go ahead and get started with our questions for today. This is really for both of our panelists. Can you talk more about the disparities in healthcare access that Latinx children and families face, and what are states doing in terms of good things to meet the needs of children and families?
Sure, I can go ahead and get started with that. Thank you so much for inviting me to be part of this panel. It's great to be here with you all. Again, my name is Gabriela. I work for an organization called the Children's Partnership. We are a children's advocacy organization in California. We are focused mostly on statewide policy advocacy, specifically advocating for child health equity on behalf of children of color, which of course includes Latinx or Latina children. And I'll be using the terms Latinx or Latina because they're more inclusive of communities that make up the Latinx diaspora, including Indigenous and Black communities, and also more inclusive of our transgender communities as well. So in terms of the population of children in California who make up the Latinx communities, it's incredibly diverse. At least in California, it's actually over half, 52% of our state's population are Latinx. And as we all know, this is not a monolithic group. Latinx communities make up multiple racial and ethnic identities. And one of the points I really wanted to emphasize first is that it's really important when looking at Latinx communities to really understand those differences within the ethnic subgroups. If we don't look at the ethnic subgroups within Latinx communities, it could mask health inequities. And one example I'll give is around healthcare coverage. So in California, for example, if you just look at Latinx children and looking at the amount of children who are uninsured, you'll see that we have about 4% of Latinx children in California, or a little bit over 210,000 of Latinx children who are uninsured. But when you go deeper and look actually into ethnic subgroups, you'll see that it's actually children, youth from Guatemalan, Salvadoran, and Mexican backgrounds who have the highest uninsurance rates within Latinx groups. They have uninsurance rates that are 8%, 5%, and 5% respectively. So I just wanted to emphasize that because it's really important when doing equity work to understand that we can't approach communities as if they are a monolithic group, and Latinx community is the same. It has many different ethnic subgroups there. So health coverage still remains a barrier, again, for specifically Guatemalan, Salvadoran, and Mexican communities, children who come from those communities in California. A couple other access issues I wanted to lift up are around the quality of healthcare. So, right, there's access and insurance rates, but then there's also what kind of healthcare, once you do have insurance, are you receiving? And from some of the data we've been analyzing from the National Survey of Children's Health, and again, this is specific to Latinx children in California, we just see that Latinx children in our state are not accessing high healthcare quality. So I'll give you a couple of examples. About 1 in 4 Latinx children in our state did not receive a preventive checkup, go to a well child care visit, for example, compared to 16% of white children. About 1 in 4 of Latinx children do not receive what's called family-centered care, where their provider spends enough time with them, listens carefully to them, and is sensitive to their values and their culture, and make them feel like a partner. And less than 1 in 3 Latinx children receive care within a medical home. And a medical home is primary care for children that is family-centered, team-based, and coordinated and accessible and responsive. A couple other points I wanted to lift up around some of the disparities and inequities that Latinx children and communities are facing in California. COVID-19 has really disproportionately impacted Latinx communities in our state and continues to disproportionately impact Latinx communities in our state. Latinx children face the highest COVID-19 cases and deaths at rates that are higher than their share of our state's population. We also, unfortunately, found a lot of data related to environmental pollution and the environmental pollution that Latinx children in California are facing. Over half of students in California schools with unsafe drinking water are Latinx. 44% of Latinx California live in communities that have poor air quality. Thank you for sharing the fact sheet. This fact sheet, the data that I'm referencing right now is actually from a fact sheet that we just published last week. And then one last data point I wanted to share is around mental health. Of course, from the pandemic, mental health challenges have been really severe for communities of color, and for Latinx communities, that has been no different. And that started even before the pandemic. So some of the statistics that we have here around mental health really highlight specifically that Latina teens are facing severe mental health challenges. 62% of Latinas in our state, over half, felt chronic sadness or hopelessness in the past year. 1 in 3 of Latina teens have considered suicide. So I just mentioned that because I think it's really important to understand, even within gender, the different inequities and disparities that are coming up. And we saw that within our research and analysis of the mental health data. And then lastly, I think there are some really great policy opportunities to address these inequities that I've been mentioning. Here in California, we're excited about a couple of different things that we're implementing. One is we're integrating promotoras, community health workers, into our state Medicaid program. And for all of you who know the incredible work of promotoras, they're really just such an important piece of our healthcare system because they have so much trust with communities. They share the same language, identity, culture, and I really think they are the way to address most, or if not all, of the inequities that children of color are facing. Connecting them to health insurance, helping their families navigate the education system, connecting them to social supports that that address the social drivers of health. So we're really excited about this new policy in our state where we're implementing promotoras, and we did it through a state plan amendment that was approved this past summer. And I'm happy to talk about that process with anyone who's interested in other states and pursuing the same. I think there's only been 2 other states who have done it so far. And then another promising policy to address, especially the health coverage issue, is something called continuous coverage. So in our work, we're always trying to identify those administrative barriers that exist within systems that make it really difficult for families to either enter a system or navigate through it. And one of the policies that we find really promising in addressing some of these administrative barriers is something called continuous coverage, where once a young child is enrolled in Medicaid, in our state it's called Medi-Cal, they stay covered continuously for the first 5 years of their life. Their parents don't need to update anything. And we're really trying to, again, address some of the administrative barriers that families face when they try and get insured and keep covered. A lot of the families that we work with have talked about randomly losing their Medi-Cal coverage, and they don't understand why. Showing up to a doctor's appointment, not having coverage, and not being able to get their child the services that they need. So continuous coverage tries and address that. And then lastly, something that we highlight in our fact sheet that we want to look deeper into is around community-defined protective factors. And protective factors are really those conditions that support, protect, and promote child health and well-being. And we're really trying to understand community-defined protective factors. What do children and families say protect them and help them? And so we started doing some research and lit review, and we highlight some that we found that are specific to Latinx communities as a whole, but there's a huge opportunity to do more community-centered research within Latinx subgroups to really understand the community-defined protective factors that support all Latinx children and families from all different communities. Stop there.
Wow, thanks so much. That was a wealth of information. And, I just want to reiterate something that you said and the previous presenter talked about was the diversity, right, within our Latinx population and our children, and how it's so important to look at that and consider that in determining how we can address that issue, because it's not one solution will fit all. And I really love learning about that continuous coverage model in California. So thanks so much for that, Gabriela. Dr. Fredericks, is there anything you would like to add to what Gabriela mentioned? Oh, you're on mute.
Yes, sure. Thank you. There isn't much left to add. She covered so much important information. So thank you so much, Gabriela. A couple of things that I could share that would complement what she's already discussed. One would be that while it is very important to look at the differences in the Latinx population in terms of background or country of origin in your lineage, it's also important to think about when immigration occurred. For instance, are you yourself someone who is foreign born and a child living in the United States? Is it your parents who are foreign born? And what is their citizenship status? Or did the migration occur further many generations ago? And because when you look at health insurance coverage for those different populations, it's very different, right? So children who are foreign born themselves with non-citizen parents, they have the highest rate of being uninsured in the United States, right? And then if you move up to children who were born in the US, so US citizen children with non-US citizen parents, they have a little bit better of an uninsured rate, but it is still below US born children with US citizen parents. So even kids who are born in the US and should have access to all of the benefits available to their peers because they're US citizen children by nature of birth, there is still this disparity. So that was just one other demographic that I thought I would draw out for the audience. The second part of your question was about what states could do. And we heard about some really great policies coming out of California. And I would say that California, while it does have these disparities, they are doing much better in terms of addressing them than most other states in the country. And so there are some advice that we could give to states is follow California's example. And while they're not ideal, go in that direction. But a lot of states are going to need to start at something more basic, right? So as Gabriela mentioned, California has Medi-Cal as their Medicaid program. And Medi-Cal does not take into consideration a child's immigration status when they are determining eligibility. But most state programs do. So California, Washington, Oregon, Illinois, Massachusetts, New York, and not a state, but importantly, DC also have had this policy for years, varying number of years. Recently, Maine and Vermont have come on board with offering Medicaid to children regardless of immigration status. And then we're seeing Connecticut with a limited offering depending on age, and then New Jersey hopefully coming on board sometime soon. There's momentum there. So one of the biggest barriers, well, not the only barrier, as we have already heard, to obtaining quality healthcare is insurance. So that would be a step in the right direction, a major accomplishment if all states in the United States could come forward with their Medicaid programs regardless of immigration status. I'll pause there.
Thank you so much, Dr. Fredericks. So let's dive a little bit deeper into that, into the challenges that Latinx children and families face when accessing healthcare, and what other policies and programs could ease and increase this access.
I think another group that I can speak to that we just hosted some listening sessions with, we were trying to understand the experiences of Latinx families who have children with special healthcare needs during the pandemic and the barriers that they were facing. And some of the barriers that they talked about specifically, especially that happened during the pandemic when everything shut down and they lost access to going to their doctors for their routines, going to, school, and it really had an impact on them. Some of the things that we heard that were difficult for those families to specifically navigate during the pandemic to access healthcare coverage for their children with special healthcare needs were a lack of, they didn't have the high-speed broadband and digital devices to be able to use telehealth, to be able to continue accessing care. And I know this is beyond healthcare coverage, but I'm just speaking to it because I think it's important to understand these specific experiences that these families were facing when they had coverage, but then found themselves in a situation where they had to pivot to be able to access their doctor using technology. So the lack of high-speed broadband, the lack of technology was a huge issue. Some of these families were non-English speaking and found it really difficult to find an interpreter to get on their telehealth appointment to access their doctor as well. They had a lot of issues. Other families were never able to even find a primary care doctor that stayed with their child for longer than one appointment. We had one family who talked about how their primary care doctor would change every time they came to their clinic and would just be whoever was on call that day. And on our fact sheet, we also talk about how it's about Latinx children in our state make up nearly half of our state's population of children with special health care needs. So we're trying to work really to understand the issues that they're facing so we can promote policy solutions that address those issues.
Thank you so much, Gabriela. I've also been fortunate enough to be involved in some research where we are able to communicate directly with families, specifically mothers, immigrant mothers. And when we talk to moms and we talk about what are the barriers to getting your child into care, and this is just in general, not specific to kids with special health care needs, and we talk about specifically the medical home. What is preventing you from establishing this medical home, the gold standard of care, as we already heard, and how few children actually have a true medical home. And so there are a lot of different factors. I'll try to run through them efficiently, but I think for the Latinx community, especially those who have any family members who are undocumented, one of the biggest concerns is this going to be safe? Is it going to be a safe place for me or other adults in my family who may be undocumented to attend with the child? That's number one. Number two, is it going to be safe for my child to use these benefits? And will that impact my ability to potentially get a green card or become a citizen in the future? Or if my child is also undocumented, their personal ability. So a lot of that is linked back to the prior public charge rule, even though use of healthcare services or Medicaid for children was never part of the public charge rule. People were very concerned about that. And so this chilling effect greatly impacted the utilization of healthcare services for children, even if it was not relevant to them. When our moms were talking about going to a clinic, they would often determine if it was safe based on word of mouth. So just what their neighbors told them, what their family members told them, it's okay for you to go here. But when they walked into the clinic, what kept them there beyond that first appointment? So if they had a good experience, meaning they felt welcomed, someone could speak to them in their language of preference, the signage potentially was in their language of preference as well. They felt like the provider took time with them and listened to their concerns, adequately explained what was going on with their child and why the treatment plan was what it was. Those were all incredibly important for establishing continuity of care, because if that first visit did not go well in the perception of the parent, then they would be looking for another clinic for the next visit. In terms of language, of course, you need that assistance if your language of preference is other than English through the entire process. So when you call to make an appointment, are you able to communicate? When you're trying to find out what the results are of your children's lab tests, are you able to communicate? So ideally having someone in person who could speak the language facilitated access to care, but at the minimum, someone on the phone, a medically certified interpreter who could do so. We also heard about just logistical concerns. You know, is the clinic located in my neighborhood? Is it within walking distance? What if I don't have a car? Can I take the bus to get there? You know, a lot of cities don't have really great public transportation systems. A lot of people are relying on friends, family members, rideshare, et cetera, to try to get to the appointment. And that person, if it's someone in your family or a friend, they may have to take off work to get you to the appointment, or you yourself may have to take off work to get to the appointment. And a lot of our families that work hourly jobs, if you don't go to work, you don't get paid. And so it's a real barrier to even attending the appointments. They recommended that clinics provide walk-in hours. Walk-ins would be incredibly helpful, especially if your work schedule changes. You can't make an appointment in advance. Evening hours, weekend hours, those were all important recommendations to facilitate access to care. And lastly, just having a sense of cultural humility. Nobody can understand everyone's culture, even if you actually speak the same language. You may have differences in your culture. And so just having trainings for everyone who works in a clinic, from the front desk staff to the medical staff to any other services that the clinic may provide, like social work, et cetera, to make sure that everybody has some training, cultural humility, as well as some implicit bias training, so that those biases that we all have, that we can't deny, we all have them, but we can at least recognize them and try to minimize them in our interactions.
Thank you so much. I want to make sure that I keep us within our allotted time. So I'll give each of you at most a couple of minutes to answer the final question. What can be done at the federal level to improve health outcomes for Latinx children? And then how can providers and child advocates at the state and local level, what can we do to help? And we can start with Carla this time first.
Sure, thank you. So at the federal level, I mean, I hate to sound like I'm just beating a dead horse, but we need to provide universal access to public health benefits like Medicaid and CHIP, the Children's Health Insurance Program, to all low-income children, regardless of immigration status. And I would expand that to say our definition of low-income children should also be standardized and be higher than it is, like the income limit should be higher than it is in some states, because it varies from state to state, as you probably know. And it's very restrictive. There are a lot of working families that fall into the gap of, I make too much for Medicaid or CHIP, but I cannot afford private insurance, or I'm not offered benefits through my job. And so that type of consistency, because the other issue is that when people are on the move, Medicaid does not transfer, right? And so if you had health insurance in one state, even if you are still eligible in the next state to which you move, you are terminated from the program in your old state and you have to reapply in your new state. That adds to gaps in care, gaps in coverage, and is very detrimental for children and families. So that would be the main thing. Regionally, barring that happening, right? Barring like a national program that would cover kids no matter where they live, no matter what their immigration status was, regions can develop systems that can provide local coverage for children to improve these disparities. So for instance, in the county in which I live, Harris County, which encompasses Houston, Texas, there is a system of primary care clinics, specialty clinics, and a hospital that are all under the same network. And they have a financial assistance program to which you can apply. And once you are approved, then you have access at all levels. And so that is just one example of something that a city or county could provide for its residents before we have universal coverage across the country.
Thank you, Dr. Fredericks. Gabriella, anything you want to add?
I completely agree with removing immigration restrictions from accessing any our Medicaid programs, but also would expand that to include any public benefits program, including those that support food access, housing access, because the social drivers of health had such a huge impact on the health and well-being of children. And then also, I think the Center for Medicaid Services also can have a lot of power in issuing guidance. The CMS issues guidance around many different kinds of topics and sometimes creates optional benefits programs that support specific populations of children in different states. I think there's huge opportunity for CMS to create guidance specifically around highlighting the policy levers that states can use to address things like administrative barriers that children and families face. And then finally, just plugging in with the child tax credit. I know there's been a lot of advocacy from all of us around making the expanded child tax credit permanent, but really emphasizing that it should also revert back to also being available to immigrant children who have ITINs as well.
Thank you so much to both of you for sharing that really important information. We do have, I don't see any questions in the chat, but we do have a couple of minutes. If there are any questions that anybody would like to ask either of our speakers, now would be the time. All right, well, you all gave us a lot to think about, a lot of really great information also to take away with us as we do our work to increase the well-being of Latinx children in our states, in our counties, and across the nation. So thank you so much. And we can get a couple of minutes back and make sure we'll be on time for the next panel. Thank you.
Thank you all.
Thank you so much for this incredibly robust discussion. And as you mentioned, it's important to highlight and understand the disparities in overall access to healthcare, plus policy solutions that keep in mind language, culture, and immigration status. And thank you for mentioning culture humility. Just because we speak the language does not mean we understand that culture's nuances. And now I'd like to introduce our next session on the state of children's education. Quality education plays an important role in future economic prosperity. The Deferred Action for Childhood Arrivals, or DACA, and other policy efforts has helped expand access to education for undocumented students in post-secondary education. This has been vital in ensuring economic opportunities. This session will feature a discussion on challenges within the education system facing Latinx families and their children, and what positive educational outcomes look like. I am excited to introduce Gladys Fatima Marquez with the Executive Committee for the National Education Association, and Dr. Florencia III, State President of Texas Association of Chicanos in Higher Education. Welcome.
Thank you. It's a pleasure to be here.
It's good having you. So I'm going to throw out the first question. Gladys, if you want to take this one, and then we'll just take turns. So what is the current state of Latinx children's education?
First of all, buenos dias a todos. Good morning and greetings from the south side of Chicago. Glad to be here. One of the biggest obstacles for English language learners is the funding of our public schools. You know, we need to make sure that our schools are fully funded, and the funding mechanism disparately impacts the quality of education that all students receive, but specifically our ELL students. Our educators are burnt out and often juggling more than one role in their schools, and we need to have the necessary funding to hire highly qualified educators, as well as buy the necessary resources to ensure that these students succeed alongside their classmates. English language learners are the fastest growing of the K-12 public school students. With more than 400 languages spoken, these students bring an array of cultural experiences and perspectives to public education. But schools are not ready as they should be to meet the needs of this growing demographic. We all know that student learning suffered during the pandemic, and ELLs were impacted by COVID-19 in ways that were disproportionate to their peers. Of course, we expected that there would be difficulty with remote access. Many of our homes, you know, the homes that our students lived in did not have adequate access, did not have accessibility. Many did not even have the mechanisms, the tablets, the IT necessary to connect. But more than that, their parents were unable to help them because they did not function, do not have the understanding of the English language to support these students. And much of this instruction was delivered in the target language, English. So that created a gap for our English language learners. We also know that parental supervision during this time was very difficult. And a lot of our students were self-regulating, were instructing. They did not have the support from their parents because they were the frontline or essential workers during that time. It was really a struggle to transition to remote learning, and certainly everyone did a heroic job, we know that, but many materials were not necessarily appropriate for ELs, and many educators didn't have the training to work with ELs in this structure. In terms of support, we know that integrated and designated English language development models of instruction work best. Instruction that emphasizes English skills as part of the overall curriculum and provides targeted time specifically for honing English language schools is a recognized best practice, but school districts are generally falling short in this. They're not implementing strategies that support English language learners. We believe that educators should be trained, and I mean all educators, on best practices in second language acquisition. General education educators must be given the opportunity in their schools, by their school districts, by their unions, to access this type of professional development. It is essential. If we don't address the needs of our English language population or ELL population, the impact will only get worse over time. Right now, ELLs are behind non-English language learners in test scores. ELLs are 20% more likely to be suspended. They tend to be over and under identified for special education, and they are likely to participate, less likely, I apologize for that, less likely to participate in extracurricular activities and have a higher level of dropout. Beyond that, the curriculum and assessments given to these students are oriented towards English speakers, which creates a set of inequities in learning and testing and disenfranchises these students. To address these inequities for Latinx students, schools must be inclusive and central to the needs of our ELLs. In many schools, ELLs comprise at least half, if not the majority, of the school student population, yet they do not have the resources needed to address their needs. Meeting the educational needs of ELLs must be part of the core of the school's practices. One of the things that we have found with our ELL students is that they need to feel secure and safe in their learning environment. And we, as educators, need to know that they're often coming into a new country and all they want to do is fit in. They want to feel a sense of belonging, appreciation. We want our educators to be, and I love the phrase that I heard earlier, to have a sense of cultural humility, to have some cultural appreciation and teach in a culturally responsive manner. Let's all imagine going somewhere and you've never been and you don't know the language or the culture. Sometimes the students come into a community without their families and their parents, much less friends, having and demonstrating that cultural responsive curriculum and humility is key to making sure that they feel safe. We can help our students by creating a buddy system in the classrooms, creating ways that they can express in their language, aspects of their culture, of their country, with their buddy, to help them share where they've come from, to help them feel included in the day-to-day activities of the school, so that they feel valued within their educational setting. We need to make the school and classroom more inviting and create opportunities for all students to share and learn from each other's cultures, and know that all of our students have feelings and passions and have the potential. We just have to make sure that we resource it and we provide all of the materials and the supports that they need. The learning process will be a lot easier if we support each and every one of our students. Thank you so much.
Thank you so much, Gladys. And you're absolutely right. If we don't address this, this has a huge impact in our local, state, and national economies. We are talking about our future workforce. So thank you very much. So Dr. Aranda, what are some of the disparities and outcomes that you see with the children, our Latinx children in education? And also if you could add what policies, programs are helping them address this.
Yeah, so again, buenos dias. It's a pleasure to be here. Feliz mes de la herencia hispana. We are deep into it. We're concluding it. So I'm excited for today's conversation because I think it's very relevant, it's needed, and it needs to happen not only during Hispanic Heritage Month, but beyond. I will give a very brief disclaimer that a lot of my area of expertise focuses on higher ed, not necessarily K through 12. However, I'll be speaking broadly and vaguely about some of the impacts that we're seeing not only in K through 12, but that also transcend into higher education. And so if you hear more of me discussing higher education, it's still regarding our Latinx youth, but they're just slightly older in age. So what I would say that I think the very first one and the most obvious one, the one that hurts me the most when I hear this is that there's this push for an erasure or omission for racial ethnic populations in their historical contributions and overall visibility in educational and governmental settings. We're seeing this constantly, and I can only speak about the state of Texas. What we're seeing here, there's been multiple laws, multiple bills signed into law. Texas Senate Bill 3, Texas House Bill 3979. Both of these pieces of legislation were designed to diminish and altogether erase important historical events and from our state's history curriculum, especially in that K through 12 system. You know, this push has also been seen in higher education now that we're starting to see the attacks on critical race theory. We're starting to see a bunch of legislative folks talk about how they're even threatening the ending of tenure for new faculty who teach critical race theory. And they identify the teaching of critical race theory would become prima facie evidence for good cause for tenure revocation. So, you know, faculty in being able to express academically and to teach the correct history is being questioned. They are being omitted, they're being silenced. And it's simply just stating, you know, information that's relevant and that's in the curriculum. They're wanting to do away with that. And so I think that's one of the first barriers that we see. The second barrier, and it's both seen in K through 12 and in higher education, is this vanishing of Latino males from the K through 12 system and from higher education. Our men are falling through the cracks. You know, there's this push for family to support the family to begin. They're being drawn into the vocational, the hard hazardous jobs, the hard labor jobs that have no type of economic or social mobility, and they're very dangerous, right? And so we're also losing them physically because of these hard demanding jobs. And so they're prioritizing entering the workforce versus focusing on obtaining an education. And I think that also is a kind of a stemmed effect of the lack of representation of Latinx professionals in the educational setting, whether in the educator role or in the leadership role. You know, research shows that about 2% of teachers in the workforce are Latino males, right? And so when a Latino male doesn't see someone that looks like them, that sounds like them, that understands their culture and who they are in their language, they're less likely to you know, engage, to be in there. And then we start to see when they're not engaged, when they're not as open and vocal about their educational journey and quest, then we start to see education systems in both K through 12 and in higher ed label them as at risk. And so now these educational settings are saying, you're at risk, you don't want to be here, you don't do this. And so then it's this vicious cycle where our students start to believe, hey, I'm not welcomed here, I'm not cared for, so why am I here, right? And so they're vanishing from our systems. And I'd like to read a quote by a famous scholar, Latina scholar, and she says, although students of color are holders and creators of knowledge, they often feel as if their histories, experiences, cultures, and languages are devalued, misinterpreted, or omitted within formal education settings. So not only is our government saying, hey, we don't want these histories in there, we're also seeing it from educational settings saying, hey, yeah, we should remove certain things. We're starting to see attacks on bilingual education. Like I said, critical race theory, cultural studies, Mexican-American studies. There is a constant push to do away with these language programs. Funding for ELLs or ELs has reduced drastically. And as Gladys said, they're the fastest growing population. And so for me, I think with this limited funding is kind of that last and final cherry on top on these barriers that our Latinx youth is looking at. You know, research shows that finances are the #1 cause cited, and again, I'm focusing on Latino males here, but cited by Latino males for their decision not to pursue higher. So if our Latino males are doing that, if we're starting to see that earlier in our previous panel, we're seeing that our Latina women are facing more and more mental struggles, mental challenges. Now you have this, the male counterpart not finishing education, and you're seeing our female counterpart struggling, right? So one of the things that we as Latinos in education always are very proud of is that we say our Latina women, they're doing it. They're finding ways to graduate college, to graduate high school, proceed into college, and our men not so much, right? But now hearing that from our health panel just brought, you know, crushed me even more to know that, you know, while they are doing it and they are succeeding, they are struggling. And so what can we do? And I think part of, and I'll transition into what we can do and some of the policies and things that we can focus on. In terms of Latino males and that assistance, there's a very wonderful group of Latino male educators who are pioneering the way through the Project Males initiative at the University of Texas, led by Victor Saenz and by Texas A&M professor Luis Don Juan. These programs are geared at creating these mentorship opportunities, college and career readiness for these men in K-12 so that they can transition into higher ed. I think part of what we're facing in terms of family is not this value gap, because oftentimes people say, oh, la familia no les importa, they don't care. No, families care and families want their children to obtain an education. What we're seeing is an information gap. So how do we include the families in a way that the information to go to college is accessible in a language that they can understand, in a way that is broken, that is accessible for them, not only translated if needed, but in terms where they can understand. We need to find ways to reach them. And so Project Males is doing a wonderful job, not only at creating that brotherhood, providing them with leadership opportunities. They also focus on health and wellness as well as identity. With the Latinidad, the diaspora is so vast and so huge. We can't all say, oh, you are all one size fits all. No, somos diferentes, somos de todas gentes. Nuestros idiomas son diferentes. We speak, we think, our cultures, our traditions, the way we love and praise are very different, even within the Latinidad, right? And so understanding that identity is an important piece. I would also add that here at Texas Christian University, when I don't serve as state president of TACHE, I work at Texas Christian University. Texas Christian University is doing a program called the Maestro Program. And this is geared for creating a pipeline for college students to become K through 12 educators so that they can leave the university prepared and ready to take on K through 12, so that there's that Latino male representation in the K through 12 system. In terms of, that push for that erasure, one of the things that we are doing through DACHE is that we're working with different entities, with IDRA or IDRA. TLEC is a coalition, the Texas Education Legislative Coalition, where we're working together and working with state representatives here in Texas to ensure that we're denouncing those types of laws or bills that are being put out there, that we're testifying and doing as best we can to ensure that we are, working to establish and show that critical race theory, that the Mexican-American studies, cultural studies, bilingual education, all of this is a celebration and recognition of who we are. Omitting it is meaning that you don't want us to be a part of your system, that you don't want us to be included in the history. And let's face it, we are Texas and American history. And so those are just some of the things, because I want to be respectful of time, but just some of the policies and things, initiatives and events, and programming that I'm seeing that could help alleviate some of those barriers.
Thank you, Dr. Aranda. You touched on so many things, like our role, in shaping U.S. history and making this country successful in what it is, and also belonging in our schools, and by teaching the history that we bring to the table, it's what are we saying about our input in this country. I loved everything you said, and so I'm going to throw a question to both of you. I know whoever wants to start first. Basically, what policy at the federal level can support positive educational outcomes? And then what states do you think are implementing unique solutions to improve these outcomes? Whoever wants to start first.
I'll jump in. Thank you so much. And I appreciate all of your comments, Dr. Aranda, especially the piece about the information gap. I am a high school bilingual ELL teacher. I've been teaching for 24 years. I love my kids. And we have a whole section on navigating the American educational system, porque no saben cómo navegar el sistema, how to apply for financial aid, how to get into colleges, what the support mechanisms are. So those comments were very, very enlightening. I think it's something that needs to be understood, that we need to come together to make sure that we provide those mechanisms for our students. In terms of policy, at the federal level, we are pushing for a whole host of issues that would positively impact our Latinx students and all students. We're calling for better funding at the national level for schools, not just for English language learners, but for all students, where Latinx students or ELL students would benefit, including through full service community schools. And I'm going to talk a little bit about community schools later on. We're calling for more and better investments in educator diversity, specifically the pipeline, developing a pipeline that creates a robust network of educators that are ethnically and linguistically diverse, so that they can support the needs of our students. We are continually calling for fair and just immigration systems so that students and their families are not in constant fear of being separated by federal law enforcement. We're calling for stricter gun control policy, so young Latinx students and all students, specifically those that we just lost in Uvalde, Texas, don't have to live in fear of going to school. We're calling for complete funding for school meals, so our students, disproportionately students of color, including Latinx students, have access to nutritious food when they go to school. And I'm going to begin by talking a little bit about honesty in education. There are a few policies at the national level that can support positive educational outcomes. And one of those policies is honesty in education. No matter what our color, what our background or zip code, we want our kids to have an education that imparts honesty about who we are as Latinos, who we are as people, right? Integrity in how we treat others, encouraged to do what's right no matter what. But some politicians, to Dr. Aranda's point, are using the dog whistle strategy of distraction and division by trying to dictate what educators say and block kids from learning our shared stories, right? Of confronting injustice to build a more perfect union and our contributions to this country. Latinx stories must be shared in our school communities, period. Hard stop. We must share our stories. We must share our struggle. We need an honest portrayal and education about Latinx contributions and challenges in this country. Our students need to see that we are fighters, that we have overcome, que la lucha sigue y que nosotros no nos vamos a ir a ningún lado. We are quickly becoming the majority in this country, and we're here to stay. At its core, culturally responsive and racially inclusive education is a renewal of a commitment to public education as a vehicle for social transformation. In support of public school communities, school boards must engage educators, students, and parents to create nurturing, learning, and teaching environments, build support and respect for educators and trained professionals, and ensure that all students can thrive regardless of their zip code, their color, or their background. We can no longer have this system where those that live in the affluent zip codes get all of the resources and those that live in the predominantly diverse and low income zip codes get nothing. That is not a thing anymore. And as advocates, as activists, everyone on this call, we need to call our politicians to the mat and say that is not okay. Every student deserves the best education possible, and you have a moral and ethical responsibility to making sure that happens. Public education must value honesty above who we are, integrity in how we treat others, encouraged to do what's right by listening to, learning from, and respecting diverse viewpoints. Through collaboration, like we're doing here today, we can come together to deeply engage in conversations that can transform education as a whole. The NEA has developed a sample resolution and guidance for community engagement that can be used as a template for local school districts to create their own school board resolutions. And you can find that template on NEA.org. This model resolution contains a commitment to affirming inclusion of all students, respect for educators and professionals, and support for a proven research-based, culturally responsive education. As it relates to ethnic studies, another way policy at the federal level can support positive educational outcomes for Latinx children is through ethnic studies and curriculums that are culturally responsive and racially inclusive. All of the data, all of the research demonstrates that when this happens, Latinx students are more academically engaged. When they see themselves in the curriculum, they are engaged, they are there. They perform better academically. They graduate at higher rates. This pedagogical approach also facilitates many of the core goals of public education, promoting democracy by preparing Latinx students for citizenship and voting, teaching cultural literacy, developing citizens' capacities for critical thinking and self-directed learning, and cultivating a workforce that can compete in the global marketplace. Teaching ethnic studies and a culturally responsive and racially inclusive curriculum is also consistent with federal and state law. Moreover, prohibiting culturally responsive and racially inclusive education harms students and likely violates federal law. Take a moment to read over those documents. They're very interesting. Nevertheless, law and policymakers across the country are attempting to prohibit honest curriculum, chill classroom instruction, stoke discrimination, and undermine faith in public education and our nation's educators. But as politicians mischaracterize and stoke fears about what is taught in our schools, educators are holding firm to their support for proven research-based and culturally responsive and racially inclusive education for all of our students. We know that our students learn best when they see themselves reflected in the curriculum and they understand the history, and the actions that preceded them, and how important it is that they are inclusive and engaging of all communities. Culturally responsive education can expand Latinx students' critical thinking and hone students' reasoning, inferencing, making, and analytical skills. Increase standardized test scores, improve math, science, reading achievement, higher GPAs, higher attendance rates, and higher rates of high school graduation are all effects of having culturally responsive pedagogy and curriculum in schools. Culturally responsive and racially inclusive education is also consistent and arguably even required by the First Amendment of the United States Constitution. The Equal Protection Clause of the United States Constitution and Title VI of the Civil Rights Act of 1964. It fulfills the promise of this country's law by advancing the free flow of ideas, interrupting systems of discrimination, and disrupting the persistent racial caste system, and promoting equal access to all benefits of social citizenship, therefore enabling the protection of Latinx students against non-physical violence. In terms of human immigration systems, we're doing a lot. So one of the other ways that policy at the federal level can support positive educational outcomes for our Latinx students, our children, is through a humane immigration system. We need an immigration system that is humane, functional, and just, and one that responds to all people and maintains America's commitment to liberty and justice for all children, all students, regardless of where they come from, what they look like, or where they live, deserve to pursue their dreams, right? The Deferred Action for Childhood Arrivals, or DACA program, has made that possible for nearly 800,000 dreamers, including 15,000 educators who live, study, and work in this country and call it their home. This program is an unqualified success, but some decision makers refuse to acknowledge that reality. Instead of honoring our dreamers' courage and commitment, they endeavor to divide and distract us by generating fear based on race and place of origin. And we must come together across racial differences, reflect the best of America's values, and make this nation where all children can pursue their dreams, no exception. This includes permanent protections and pathways to citizenship for dreamers and other undocumented immigrants, and any must-pass legislation that moves forward this year. So we're working hard on that. And community schools is the last piece I'd like to talk to in terms of policy. Community schools is another powerful tool to ensure the success of Latinx students. Community schools are built with the understanding that students often come to the classroom with challenges that impact their ability to learn, explore, and develop to their greatest potential. Because learning never happens in isolation, community schools focuses on what students in the community truly need to succeed. And that's whether it is language services or healthy meals or healthcare, tutoring, mental health counseling, or any other tailored service. Community schools creates a model where community stakeholders, parents, administration, and educators come together to identify where the gaps are, where they are in terms of academics, health, social service, youth and community development, where there is a need for community engagement. Community schools provide not only tremendous opportunities for learning and success for students, but they also offer hope, opportunity, and transformation.
Thank you, Gladys. Dr. Aranda, would you like to add some final words?
Absolutely. So I think Gladys really hit the nail on the head on a lot of that funding. I would add a lot of the funding, a lot of the information regarding funding and the policies that that would really impact Latino students. I think it boils down to that funding. Funding Title III for ELs is absolutely imperative. Funding Hispanic serving institutions. This is the designated distinction and status given to colleges and universities that have 25% or more Latinos in their student body. Federal money is poured to or is available for that university or college to apply to receive funding, HSI funding, and then use that money to serve those institutions and those students. And so I think really pouring into the HSI initiative is imperative. Establishing that permanent DACA program. We're starting to see so many attacks on our DACA brothers and sisters, you know, with that state, Texas state judge who is basically trying to do away with the DACA program. The Fifth Circuit Court of Appeals just sent it back to him, an anti-immigration judge, to see what happens with the future of the DACA program. And so I think it's imperative that we continue to, you know, not give up and to continue to fight for that permanent establishment of that DACA program. And I would say also paying for the Texas or providing funded for the TRIO Student Support Services initiatives at the federal level. This is a federal initiative that pours into first generation students, low income students, as well as students with disabilities. So I think that is absolutely imperative. And to very quickly kind of sum up what some of the things that we could do, at least in the state of Texas, there's the Texas DREAM Act, not to be confused with the Federal DREAM Act, but the Texas DREAM Act is one that should continue to be looked into and poured into, because it grants in-state tuition to individuals that are that identify as residents of the state of Texas, regardless of their status. And so this is absolutely imperative for our undocumented immigrant youth, especially here in Texas. That push for the Texas top 10% rule. So this is an equal playing field rule that if you are within the top 10% of your class, of your K through 12 graduating class, at a public institution, you're granted automatic admission into a public higher education institution. And since its inception, there's been multiple attempts to do away with the Texas top 10% rule. But I think, you know, every year it gets, or every legislative year, it gets struck down. And so I think it's imperative that we continue to fight for that. And lastly, I would say just funding for bilingual educator teacher prep programs, because they are the future that is needed. You know, as Gladys said, our bilingual language speakers are the majority, and there's so many languages being taught out there, and they come with those languages from their upbringing. And so I think it's necessary that we continue to pour into those bilingual teacher preparation programs so that our educators are ready and able to truly and effectively teach our bilingual students.
Thank you, Dr. Aranda. Thank you, Gladys. We really appreciate you being here and the incredible information you shared. We're going to skip the questions, but I do invite you to look at the chat and look at the Q&A section. I think there were a couple of questions for you. So we're going to go ahead and transition to our next section on economic justice. This session will be moderated by Cyriac Alvarez Valle, Senior Policy Analyst at Voices for Utah Children. And joining her for this discussion is Maestro, co-founder and chief of operations at Community Preschools, and Dr. Sylvia Acosta, Senior Vice President and Chief Growth Officer at the National Minority Supplier Development Council. Can you all join me on camera? And Cyriac, it's your show. Go for it.
Thank you so much, Ana. It's so great to be here. It's so great to be here with you, Hasiel and Dr. Acosta. My name is Siriak, and I am so excited to be surrounded by amazing advocates like yourselves. And in this panel, we're going to talk about economic justice as it relates to Latino and immigrant Latino children and families. Economic justice is really about working towards a country or a place where everyone has the opportunity to thrive. But unfortunately, we know that that's not the case right now. As it was said before, about 15% of the Latino population lives in poverty. And while childhood poverty fell for Latinos, we know that from 29 to 8.4, there's still a lot of work to be done when we consider these two data points in itself. And we know that there's a lot of work that we can do at the state level, like advocacy organizations like mine do, but also at the national level. And when we consider the Latino community, we know that depending on where they are or what their identities are, there are unique challenges that they may face. For example, if they're maybe come from immigrant families or Afro-Latino families, live in poverty, live in red state, or live in rural areas, just to name a few. So I'm excited to talk to you both about how we address these challenges when we consider economic justice, and what policy approaches may or may not have been taken, and then just learning about ways that we can create policy solutions that fit the needs of our Latino community, again, considering how diverse it is. So yeah, for everyone listening, feel free to put any questions in the chat. We'll try to get to them at the end. If not, we'll try to get them answered after our panel. So I want to get started with you, Hasiel, by asking you a couple of questions. So what do you think are some of the challenges that you see in terms of economic justice as it relates to poverty, and what steps have been taken to address these challenges, if any, and or harmful policies?
Absolutely. Good morning. And I'm a father. I have 4 kids, and it's really interesting because when the babies are small, when they're tiny, they can't really tell the difference between self and others. It's incredible how they think we're all just one and the same. And I think the same happens in poverty, because you grow up in it and you're thinking that everybody must have the same challenges as you. And it's not until we introduce the word economic, that's really is the trigger that helps you see like, wow, this is so much more complex than what I imagined. And it really is a lifelong endeavor to learn the complexity of what it means to be in poverty and to come out of it. But I do think that the word justice there is critical, because that's a mindset. And I'm a DACA recipient, I'm an immigrant, and it was that mindset that my parents gave me, that you can take action and that there is responsibility on your end to walk this path, but they provided the path. And I think that's where the policy needs to be very intentional, is defining the path to success, whatever success looks like. For me, I run early childhood centers, and I had a lot of mentors, and my parents always brought people around me in areas where they could not help me. So having a clear path to economic success is critical to see folks come out of it and then come back and give back. From a policy perspective, I work in early childhood specifically, and I see a lot of interest nationally. It's been incredible to see, right before the pandemic and into these past few years, to see a national interest to see young children thrive. We realize that Cheetos and TV aren't going to get children where they need to be, and especially because most of their brain development takes place before the age of 4.
Right.
And I do think that there's a significant amount of investment right now in rethinking education, not just K-12. I used to work in the K-12 system. Gosh, we couldn't get kids through by 3rd grade. Why? Because we need to invest. That economic investment needs to happen so much earlier, and the return is just incredible. So there's a lot of potential there.
Yeah, thank you, Hasiel. I really like what you said about that economic sorry, I lost the word. Investment, the economic investment that has to happen early. Here at my organization at Voices for Touch Children, we do focus on early childhood education, and we know that just the gaps that exist for families to even obtain childcare, and it doesn't matter where you are on the spectrum, it's an issue that like everyone's been facing, from someone who's a surgeon to someone who may have like a job that pays hourly. And so thank you for sharing that. And when we think about economic justice, like mentioned before, it impacts families differently. And when we consider the identity of Latino families, we know there are disparities. So this question is for you, Sylvia. What do you think are some of the biggest disparities in economic access to Latinx children and families? With Latinx youth being one of the fastest growing populations, what do you think are some potential implications if the disparities aren't addressed? Oh, I think you're on mute.
Thank you so much for allowing me to be here. I appreciate Hasiel's comments on the focus on early childhood education. My concern with that is that it's not proportionally focused. So what we have is a lot of childcare deserts throughout the state of Texas and throughout the country. And most of those childcare deserts are in communities of color, and they are in communities that are impoverished. And many times it is those families that require the most amount of support, yet find the least amount of financial and political support nationally. So I think we need to frame this as part of who we are as a country. So a quarter of all children in this country are Latinos. 40% of those exist in southwestern states. So when you look at states like Texas, Colorado, New Mexico, California, those children that populate those states are Latino children. And when you look at poverty rates, even if you just go, back to just recently with COVID, children that were Latinos and Blacks suffered 3 to 4 hardships in relation. If you relate that to white children and Asian children, they may have had 1 or 0. And what are those hardships? That was health issues, death in family, food insecurity, lack of access to internet, lack of access to educational programs. And so you have all of this inequity in our country. And it is specifically occurring in not just Latino communities, but in African-American communities and communities that are impoverished. But we have to be very deliberate about what our conversation is. And our conversation cannot be a conversation that states that we're all in, like, we need to do this together. Yes, we do need to do it together, but we need to invest in Latino communities. Latino communities, if you were to look at the United States as a country, and you were to segment from there Latinos, all Latinos, we would just within ourselves, we would be the 5th largest GDP in the world. We would be larger, just Latinos would be larger than the UK, our GDP, just in the United States, then the UK, then France, and then India. That is what we represent to this country. We represent a very large GDP. However, we do not represent that investment in our community. So I think that as Latinos, we need to understand our financial power. We need to understand our economic strength. And then we need to demand that the support for our communities resemble the economic strength of our people. And so public policy, when you approach public policy, I've always felt like it has to come from an economic development standpoint. And when you approach it from that way and you use those numbers, people are more willing to listen to you. And when you come from a place of power instead of a place of weakness, people are able to, I think, get the point much quicker. And I think that in public policy, we need to start approaching it from that angle. Like, we are the 5th largest GDP in the world, just Latinos. And we represent the highest growing business, the highest women-owned businesses, far outrank businesses started by other females of other ethnic groups. So what I'm saying is that the public policy needs to begin to mirror our economic strength. And we need to vote.
Also, yes. Thank you. No, I really appreciate those comments about considering our economic strength as a Latino community, because I think it is often overlooked. And people like outside might look at the Latino community in like one specific like way, but we are so much more diverse when it comes to like how many businesses we have, where the different countries that we come from, the different needs that we have. And Hasiel, I'd really like to ask you, like, considering what Dr. Acosta said, how can we create these policies that meet the needs of the diverse Latino population? And what do you think state and local children's advocate like organizations like mine can do to help like do this work, especially considering that economic strength that Dr. Acosta mentioned?
Yeah, I completely agree with Dr. Acosta. The marginalized communities had the biggest impact during COVID, that educational outcomes for kids in our communities. It's an indicator that the supports are not there. And completely agree. So for our approach, we work bottoms up. We do not make cases of things that we are not, if we're not connected to the families and we're not seeing the data, then it's hard for us to make a case at local, state level to make changes. And I've been in a number of groups or panels of people that are making decisions for early childhood, for example, for my communities that have never operated a center and have no real practical knowledge of the impact of their policy in leading a top-down approach into how policy is made. And so here at Community Preschools, really our goal is to become the nation's leading data-driven disruptor and validator, of course, of early childhood best practices, because we know that the return on investment for every dollar is 12 when you invest in early childhood. And so it is critical that we have a bottoms-up approach that it collects data in a robust way. And I love that at Children at Risk. I mean, I meet with your team all the time, and they're always asking, are we asking the right questions? Are we looking at the right maps? Are you seeing this in the community? This validation is critical. And because I'm hearing it, I see it all the time. And then we also need the top-down approach. We need to involve more people, as Dr. Acosta mentioned, in these groups, in policies, and inviting them to the table to have a voice and for them to understand that they have authority because of who they represent. And there is so much that we can do, but there is mentorship, there's empowerment, there is relationships that we need to build with those folks to empower them to come to the table and have substantial contributions, because they represent thousands and thousands of people.
Thank you, Hasiel. Dr. Acosta, any thoughts?
I think we need to reframe the entire conversation. Like, I think that the conversation that we have had nationally regarding Latino needs and the conversation that we've had on a state basis is always coming from a place of deficit. It's like, what is it that we need? What is it? I think we need to change the conversation and talk about what it is that we bring to the table. We bring to the table families that are bilingual. If you ask any, 95% of the world exists outside of the United States. And those markets outside of the United States tend to be Latino. And so for businesses and for government, they should become, like, our conversation needs to be, you need to understand who we are. You need to invest in who we are, because if United States does not invest in Latinos, they do not invest in Latinos, this country is not going to succeed. We are going to fail. We are the largest population in this nation of minorities, and we will be the majority minority in the next 10 years. If the United States government and if corporations do not understand the competitive advantage that Latinos bring to the table because of our sheer population, because of the fact that we are bilingual. So we open the doors to the rest of the world, Latinos do. And so that when I talk about a conversation change, we always present our information from a deficit perspective. We need to walk into those rooms fully knowledgeable, but we need to educate ourselves as well, fully knowledgeable of who we are as a consumer, who we will be as voters, and who we will be as the future workforce. We are currently the largest workforce in this country. And employers should be aware of that. And if they're not investing in early childhood education for our kids, and if they continue to lack, as they mentioned in the previous panel, to not invest in education period in communities of color, this nation is not going to be competitive. Our competitive advantage is our Latinidad in this country. We are the competitive advantage, and we need to start talking about ourselves that way. And we need to stop talking about ourselves from this deficit perspective. Just because it's the facts. I mean, it's just facts.
Thank you, Dr. Acosta. I really like that reframing the conversation and reframing how we even consider ourselves coming into these conversations about policies. And Haciel, I really like what you said about how oftentimes these policy decisions are often made from the top down, where we don't consider the needs and that practical side of implementing policy. And as a policy advocate myself, that is something that I really try to consider, because I can walk away, right? I can say like, okay, we passed this policy, like, here you guys go. But not being able to truly understand that implementation phase can really hurt families, even when it's supposedly, right, like a win. And so I know we have just a couple of minutes left, and I don't see any questions. Oh wait,
So,
actually, I see one. Go ahead.
That was critical. It's what kind of points can we look at? And so in Houston, with the centers that we're supporting, is we take attendance data, and we want to understand how many days the child is attending school, the quality of the program, the changes or the growth the child is experiencing over periods of time. Attendance data can tell you such important things about the growth and the supports that child is getting. And so I would highly recommend it as a data point to collect as a starting point. And there is a significant interest, again, with House Bill 3 here in Texas, with bringing more resources to early childhood in marginalized communities, with the restructuring of subsidy systems to better support our community, with real intentional supports on the food program to make sure that we get food to our families even after school. And so there's a significant amount of push to integrate resources and to get them to families that need them. But I think we do have to be Latinos, as Dr. Acosta said, we have to be at the table driving the decisions on how these policies are implemented and where and in what timeframes. And so,
Thank you, Haciel.
Thank you, Tanya, for the question.
Yeah, thank you, Tanya. And just, we didn't hear it. They are working for Advanced San Antonio and do a lot of work in childhood, predominantly Latinx communities, and asking for data points. So thank you, Haciel, for sharing your thoughts on that. The second question we have, maybe for you, Dr. Acosta, is can you address how Latinos are hired by companies for their bilingual skills and not compensated for them? And that might just be true, right, like for so many different places. So any thoughts?
I always have thoughts and I always have opinions. So let me just begin by saying that we need to think. So when kids are young, I remember when I was a little girl, my mom and my dad didn't speak any English. So as a little girl, I used to have to read like whatever was coming from the electric company or whatever, translate that to my parents, and then they used to usually say, like, can you send them something, or can you answer them, or can you call them? So what we don't understand as Latinos is that we have skills that we have built up that are so incredibly valuable. So what happens with that is that Latino children, especially that are raised in monolingual Spanish-speaking families, they have discernment. They have a discernment quality that is lacking in children that may not have experienced that. So when you go to a meeting and you hear people and they're talking and everybody has an opinion, if you have a Latino that had to do this for their parents, they know exactly what the key points are to that conversation, because we had to learn how to do that when our teachers were talking to our parents. So our teachers would say this in English, and then we'd have to like, okay, what was the most important thing that they said? Discern what that was, translate that to the parent, and then the parent translate that, tell you, and then you had to think, how do I translate that to the teacher? Those skills are not just bilingual skills. Those are not just language skills. Those are discernment skills that we have as Latinos that we have not elevated in our conversations when we talk about the skills that Latinos bring as a community to this country. So I think that that happens quite a lot, and it's shameful, but it also has to do with the way that we talk about ourselves as a community. We come in, our community is very humble, and our community, many of the people that go in to look for jobs do not know how to negotiate, because they may never have known somebody that can help them negotiate. They don't think they need to negotiate. They're just happy to have a job. And I think that there has to be a change in the way that we approach these situations with our kids. We need to begin to teach not just financial literacy to our kids. We need to teach them the power and the strength they bring as Latinos, as bilingual individuals that were raised in multicultural families. We need to begin to talk about that and teach them that, so that when they get into a position where they are being hired, that they can say, I just want to let you know that I am bilingual and I bring that additional skill. Is there because sometimes they have it, they just don't tell you. Is there an additional pay scale for people that are bilingual? So we may just not be asking those questions because we're just happy they're giving us a job. And we need to teach our kids not just financial literacy, but how to negotiate. And we need to have, as Hasiel said earlier, a whole lot more mentorship, not just on the high school and teenage, but throughout our lives, so that people can understand their value. I'm just on this kick right now about the fact, because I'm traveling nationally and I see all of the things that are happening nationally. And what I realize is that our community needs to speak up, and our community needs to understand the value we hold in this country, and we have to start talking about it. I think when we start talking about it that way, voting will go up, because now we're not saying you need to vote because we're desperate, or no, we need to vote because you're in control. We need to vote because you are like the leading population, and if you your voice matters. So yeah, so that's what I think. I think there needs to be just a lot of conversations as it relates to those particular areas.
All right. Thank you so much, Dr. Acosta, and thank you so much, Hasiel, for all of the information you shared. I know that I'm walking away with a lot, and if there are any more questions, please feel free to put them in the chat. I know that they'll probably stick around for a little bit to answer anything in addition. And with that, I'll pass it back to you, Anna, and just thank you all for joining us in this panel today.
Thank you. Thank you very much for this incredible discussion on how policies must mirror our economic strength and financial power. We never talk like that, right? And the return of investment in our early childhood education and K through 12 for our communities to ensure the success of our country. You know, so I love that. And so now I'd like to introduce our next session today on the state of mental health. Many children and families already face barriers in accessing mental health care, and the COVID-19 pandemic exacerbated a mental health crisis in our country. Here to discuss this and what more we can do to advocate for better support are our panelists. Alisa Torres, Director of Mental Equity at Mental Health America, and Enrique Mata, Executive Director of Paso del Norte Center at Meadows Mental Health Policy Institute. Welcome both.
Thank you, Anna. It's an honor to be here.
Yes, thank you. So I'm going to go ahead and start us off. And what I'll do is some of the questions will be for both of you, but I'll start with Alyssa and then we'll go into you, Enrique. So Alyssa, what is the current status of mental health for Latinx children and families? You're on mute.
My bad. So today, actually, Mental Health America released our annual report, the state of mental health in America. So I do have just a little bit of fresh data for you all. We did find that Hispanic adults with any mental illness are least likely to have health insurance among the various cultures, with only about 19% reporting that they were covered by insurance. And so, that they were reporting not covered by insurance. And so also, despite participating in the workforce at higher rates than non-Hispanic populations, we also know that Hispanic adults are least likely to receive employer-sponsored health insurance and are more likely to enroll in Medicaid. So unfortunately, what we're seeing is that that has a big effect on families, on children, and on the overall health of Latinx communities. And in addition to that, we know that over time, mental health outcomes tend to decline and become similar to the general US population, with Hispanic immigrants, specifically individuals who are born in the US, tend to have lower rates of mental health, higher rates of mental health conditions than individuals who were born in other Hispanic countries and immigrated here within the first generation. As people tend to stay longer, there's more stress from assimilation, and there's a need really for much more support for individuals. In addition to that, we also know that as of 2020, Hispanic young adults aged 18 to 25 were more than twice as likely to experience major depressive episodes with severe impairment. And they continue to report rising rates of major depressive episodes. So in addition to that as well, we know that about 2/5 of Hispanic people aged 12 or older tend to have used alcohol within the past month. And what we also know is that mental health problems can be hard to identify for Latinx and Hispanic people. So oftentimes individuals within Latinx and Hispanic cultures will often focus on physical symptoms rather than psychiatric symptoms. And we also know that there's a lot of concern with the various types of culturally responsive care that individuals can receive, and the way that they can navigate these, typically difficult systems of healthcare and insurance. So possibly due to that, we also know that Latinx and Hispanic adolescents who use antidepressants or who use stimulants for ADHD use those at half the rate of their white children. But we know that about 2/5 of people who are Hispanic aged 12 or older have used alcohol within the past month. And like I said before, that there are rising rates of major depressive episodes. So we know that there's a big gap there that we need to address, and that there's quite a lot of different ways that we need to address these concerns.
Thank you, Alyssa. And Enrique, same question for you. What do you think is the current status on mental health in our children?
Well, similarly, when we look at those data, we're certainly seeing 50% of mental illnesses start before the age of 14. And, looking at those kind of data, and then we start to see that, 1 in 10, like I'm looking at Texas data and seeing 1 in 3 Texas children experience a mental health disorder in any given year. These are challenges, but more so when we talk about maintaining a nurturing environment, which is one of the most important things you can do for children. 11 million adults who are suffering from major depression, 35% of those adults with major depression are receiving no treatment right now. So many times you've seen things like masking and self-medication by using alcohol or other things, and it causes conditions for children to grow up and in an environment that's challenging and can create adverse childhood experiences. So when we think about things like negative bias and stigma and the considerations that we have to face with the way our community and our culture look at mental health, we really need to dispel some of those myths and facts surrounding that topic. And one of the things that we're looking at here is that we've seen these tragedies that have happened, but you're seeing these data that are coming. They're not just from the time of these tragedies, but also and the worldwide pandemic, of course. But they were already to some degree increasing. I think where we have a great opportunity right now is that there's the strength of the culture and tradition of the Latinx community, the importance of connection within that culture and tradition are things that can be solutions to our community, things that can help us to unite for better care, for really looking at and embracing the idea that mental health conditions, they're more common than people might think. We note that the Hispanic or Latino population, they're more likely not to have a usual source of care, a point of care like physician to go to on a regular basis to check in. Those kind of things are things that we need to begin to look at and say, how do we do a better job of coordinating that kind of care? And how do we do a better job of really embracing that? And I know hearing the presentation earlier from Dr. Acosta, she's talking about the exact thing, cultural and linguistic competence and representation of providers in the workforce that are understanding of the Latino population and even experientially have grown up in that community and understand the conditions that folks might face and are able to help to overcome those barriers by providing direct solutions that are well-founded, but also very supportive of culture. So we can continue to talk about the difficulties in data. One of the things that comes up, of course, is workforce and the idea that people aren't going into the mental health arena like we see. We're seeing people going in the service industry, but the fact is it's because they're getting paid well. When you're talking about mental health conditions, folks in that arena, those types of positions are things that they deal with particularly difficult situations, and they're not getting the reimbursement or the payment of that sort for the kind of work that we're doing. So as a nation, those are things that we need to be paying attention to.
Thank you, Enrique. Alyssa, anything you'd like to add before I go to the next question for both of you?
I'd say that just to address some of the challenges as well, we know that things like insurance can be really, really complex for individuals, especially individuals who aren't familiar with the insurance system. So we need to provide ways to assist individuals in navigating the healthcare system and the insurance system. So that can mean, really talking to clients and patients about what these processes might look like, providing resources when possible, creating your own resources when possible. And we also need to provide more flexible options for mental health care. One thing that we've seen across the board is that there's definitely a concern on the working hours for individuals and how they can access mental health care within their working hours. For individuals who are in fact working multiple jobs, that can be a real issue for them in order to actually find the care that they need. If providers aren't available in the evenings, if providers aren't available on the weekends, then that might discourage individuals from ever receiving the help that they could get. So finding ways to break down those barriers can be really helpful, expanding hours, hiring more staff. In addition, also hiring more culturally responsive staff and representative staff as well. Finding ways to really encourage individuals to get into this workforce and to be a representation of their own community within this workforce can be really vital to individuals understanding the need for mental health care and understanding how they can actually see themselves within these possibilities.
Great, thank you, Alyssa. And this question is for both of you. Advocacy can be done at the federal level to help provide access to mental health care and improve mental health outcomes. Enrique, do you want to start?
Sure, happy to. Yes, certainly, when we start to look at policy and practice, that's some of the things that it's been an honor to be a part of as we start working through this. But what we see is, when you look at things that are happening in the front lines, trying to identify ways to help people with real-time evidence-based programs that work, that we see that work. Advocating for things like reimbursement models. I mean, people talk about those topics like reimbursement. Oh, what's that? That's really difficult to understand. But it's important to understand that things like, Medicaid, those adequate reimbursements need to be there so that we can get people on a career path and understanding that, it takes this, that just like we were talking about just a moment ago with the service industry. This is one of those areas where we need to advocate and look at how best. I mean, we're in a time when opportunity has developed. People are talking about this topic, and we're seeing some of the highest numbers of allocations of resources towards this arena. So how do we prioritize those things? I know in Texas, what we've been looking at is expanding opportunities for programs like multisystemic therapy, or we looked at some models around the country like the child psychiatry access programs. In Texas, we call that the Child Psychiatry Access Network. But these are programs that reduce the stigma because it puts the primary care providers back in the front, helping people to walk in and on their terms talk about mental health, and then having that coordination of care done at that level within that center. Not necessarily does everybody need to go into the mental health system. Many times those kind of situations can be handled in the pediatric or primary care setting. And as we look at earlier stages of trying to address illnesses, preventing crisis, we got to look at our children, our families, and look at them with more care. And then understanding that programs like this, where you have ready access, that the provider has ready access to the specialty care to consult almost on a real-time basis and say, there's a situation here with a child, and we'd like to ensure that they get the best care possible, the best diagnostic approach, the best medication access, the best counseling access. Those kind of things are vital to us preventing the kinds of situations that happen later on in life, risky behaviors, major depression issues, all the way to even suicidal ideations. And so those are conditions that we really have to be paying attention to, getting to where we have connections into the schools. I know in Texas, we've been exploring the Texas Child Access to Telehealth program and expanding that ability to have early access within the school so that when conditions come up, you can help connect people with the services they need, and then maintain that connection through their service providers, reinforcing again that folks need to have good service provision. Also, we are looking at how best can you address conditions to prevent people from falling into the justice system inappropriately. Children and families are raised by adults, and sometimes those adults are having their own conditions. Sometimes that happens where they fall into a situation that, in lieu of being in a mental health crisis, they are just defaulted into the justice system. That can be such a damaging and lifelong changing condition, and it could have maybe been averted. So exploring appropriate kinds of responses to situations and ensuring that people who are maybe experience a mental health crisis, they're not inappropriately sidetracked into the justice system when they could have also gotten to a timely care, timely assessment, and accurate diagnosis, helping to maintain always that nurturing environment for children. I'll stop there for a bit. Sorry.
Thank you, Enrique. No, thank you so much. And you're right, that's such an important to look at that pipeline, right, of where children go to the juvenile detention system. It becomes then the cycle, it's just kind of hard to get footing. But Alyssa, would you please answer like the same question we just asked?
Yeah, so with Mental Health America, we focus a lot on advocacy at state, federal, and local levels. So we actually have quite a few calls to action that we ask individuals to consider when considering advocacy. So one of those is to encourage federal and state agencies to write into their grants the need for memoranda of understanding, which establishes cross-sector partnerships that build the cooperation necessary to meet mental health related social needs. In addition, advocate on federal, state, and county governments to track cross-sector savings and create mechanisms for reinvestment through, for example, wellness trusts. In addition, expand screening beyond health conditions to include health-related social needs and promote flexible financing models that allow for systems to address those identified needs. That really goes back into what I was saying earlier about the needs to have flexibility, whether that's with hours, with financing models as well. And really focusing in on those social determinants of health. In addition, advocating for programs to incorporate peer support specialists across all settings, which can help address the health-related social needs and really bring in that community care aspect that is really needed in Latinx communities. As well as we really want to assure that state and federal levels, that the impacts of healthcare reform changes are monitored and corrected as needed to promote integration of care. In addition to that, we want to expand recovery programs to add tools to address wellness goals. And we want to make sure that programs are applying a public health approach and population-based interventions. So really working with recovery-oriented clubhouses and other programs to develop a wellness culture among people in recovery. In addition to that as well, we want to improve access to general medical health care and the development of primary health care and behavioral health care homes and total accountable care organizations. So ultimately, we really want to fund, regulate, and require and lead the public behavioral health care system to ensure prevention, screening, and treatment of general health care issues. And Enrique hit quite the nail on the head here with all the things that he mentioned as well. Expanding coverage, expanding telehealth opportunities as well. There are quite a lot of different ways that we can incorporate more culturally responsive care into our advocacy. So when advocating on the state or local level, I always encourage individuals to really talk about community care aspects, talking about the inclusion of care models outside of the Western medical model as well, finding ways to bridge that gap with communities. There's also ways to utilize faith-based programs as well. For many individuals within the Latinx community, faith plays a key role in their understanding of wellness. And if there is a way to train faith leaders or to help bridge that gap with mental health care through faith leaders, that is always something that we want to encourage.
Thank you very much. I think we have a question from the audience. And they're asking, can you talk about grief in the Latinx community and the impact on their mental health? And also would like to know what we can do to help reduce the stigma of mental health services among this population.
I'm ready to go.
Yeah, no.
Okay, well, if that's okay, I'll go ahead. So in the topic of grief, that is truly one of those arenas that has been under responded to. So, and when we talk about that in that just proper vocabulary for that, but certainly, grief, when we talk about trauma-informed care, we've been looking at traumatic events, adverse childhood situations, but there's a pathway in grief. Grief is one of these arenas that's, it's really been one that we're paying more attention to now, and more so now that we've seen some conditions that have changed as a result of the pandemic, where we've had families broken up because of the loss of a family member, whether it's a grandmother, a mother, those kind of situations, and really looking best at how to address that. And in Texas, one of the things that we've got, the Institute has been working closely with the Hackett Center Trauma and Grief Center that they've developed, and we're really looking at these kind of topics. Dr. Julie Capel has been working with us on how to expand and address grief in ways that will help for long-lasting support for children and families. But it is certainly a topic because of the numbers. I mean, worldwide we've seen that, but the numbers are alarming when we start to talk about grief conditions. So that's an important topic, and thank you for bringing it up. And what was the second part of that question?
Oh, it's gone. I think that you answered the part of how to reduce the stigma, like from asking for help.
One thing that I'll mention for stigma is that you cannot count out the importance of cross-collaboration in the community. When we talk about connection, it's not just about the connection of individuals inside of their families, but actually organizational connection. We've got to get away from those personality conditions, and we start to talk about the situations. I had a good leader in our community that started to say, until we move away from pointing fingers at each other, we know these kind of traumas are going to happen in our community, tragedies will happen, but for many reasons, those things are things that will be unavoidable, and we can't point fingers at each other as organizations, as community leaders, as policymakers, saying that it's your fault because something happened. We have to be looking at the conditions that created that situation, how best to prevent those situations, and recognize that there are cultural and community factors that are unique. And so when we develop policies, they should be policies that free people to make good decisions with the tools to implement those decisions when they're made.
Well, thank you. Thank you, Enrique. Thank you, Alyssa. We really appreciate you sharing your insights and your thoughts on how to address this very important issue in our community. And now I would like to introduce our next session today on engaging the community Latinx-centric solutions. It is vital that when discussing challenges in creating policy and programs, that we support our community and hear their voices and make sure that those voices are centered. Here to discuss this and how to engage the community in advocacy efforts are our panelists, Angelica Razo, Texas State Director at Mi Familia Vota, and Jose Alfaro, Director of Latinx Leadership and Engagement at Everytown. Welcome, Angelica. Welcome, Jose.
Hola, hola.
Hola. Buenos días, buenas tardes for some of you. So we'll start with Angelica, and then Jose, I'll give you the same question. So why are community-centered solutions important? And would you please share some examples?
Mm-hmm. Yeah, absolutely. Really great to be here with everyone today. Excited for the conversation we're going to have. I would say for grassroots organization, community-centered solutions make sense. Some of the differences that you might see is advocates think long-term, policymakers think long-term. We're talking about issues that are heavy. We're talking about mental illness. We're talking about, across all the issue areas that Mi Familia Vota works in, environmental justice, immigration, things that we all know involve federal, local, state level governments and take a lot of political will to pass. From the community perspective, from my own personal perspective, community members want solutions now. They need things that are going to change their life now. And so some of the examples that come to mind where I've seen ongoing and successful community center solutions include, if we don't have a comprehensive immigration reform, but we know that their folks are at risk of getting detained, deported because they don't have an ID, can library cards be used as a substitute, right? Would that be allowed by local jurisdictions? I think that's a really great example, something that could, again, drastically change someone's life now. Some of the other campaigns that we've seen here in the Harris County area is in the aftermath of Harvey, the hundreds of houses that still need to be weatherized and retrofitted for the future oncoming storms, right? That are going to add to people's houses being destroyed and, leading folks into more economic despair. Other folks, policymakers, think tanks might think about, how are we combating climate change from a more global level, from a more federal level, with 10, 20, 30 years down the line. Community members need action now, and they need something that's going to really have an impact on their life now in this generation. And that perspective should never get lost. And I think, grassroots organizations have to sometimes serve as that liaison between the different levels of government, between the different agencies and departments that need to be the ones that are providing pathways for community center solutions to be successful. And we sometimes have to navigate the lack of political will that we see in some of these departments, some of these elected officials, and really empower community members to hold their ground, to stand their ground, and that they feel confident. No, this is a good solution. There is a way to negotiate. There is a way to be successful. But I think we should never lose sight that we know these things take time. We know there's congressional terms involved. There's state legislators involved. It's a matter of who's in office. But that's not always a good excuse for not getting things done now, and making sure that we're providing a positive difference in people's lives now, because that's when people need it.
Thank you, Angelica. Thank you so much for that. And Jose, how do you engage the community in advocacy efforts, and what impact have you seen their involvement have?
Yeah, so first and foremost, I think, it's important to name that communities have always had community leaders, right? Our communities are self-determined, our communities have the solutions at hand. And oftentimes what happens in our communities is that folks come in and swoop in and think that they have solutions to problems or issues relative to their particular experiences. And so one of the ways that we really think about working with community is how are we listening to the community, but then also creating culturally relevant content, in ensuring that communities have culturally relevant events and education, so that they have all of the information that they need to advocate for themselves. Right. I think one of the biggest pieces that I think often goes unnoted is how community members become advocates. And when they become advocates, they are advocates for life, whether it's getting a better understanding of the Board of Education process, or getting a better understanding of their city council electeds, as well as their state legislatures. They then become more informed and have a better grasp of the issue. And so the impact is that you have lifelong community leaders, community activists, and organizers in their communities, similar to what Angelica is saying, to start to galvanize our communities to ensure that legislators and elected officials are being held accountable, but then also to ensure that we have action now.
Thank you for that answer. And Angelica, did you want to add anything to that before I go to my third question for both of you?
I will just add that there's a lot of, and this might go and lead into our next conversation, but listening is so important. I can't express that enough, because sometimes community members are speaking to us, and we already have these preset determinations of the terms we want to hear, the type of language we want to see them use. And that's just not the case. That's not reality. We can't expect people to be in the same mindset that we might already be, because everybody has their own journey to advocacy, to becoming a leader in their community. And they have their own personal reasons why they might step into this space, and that's okay. But I think part of organizing, let's be on a pathway for collective action. So a lot of people, our entire community, can benefit from the solutions we're trying to put forward.
Thank you. And this question is for both of you. What do advocates get wrong when trying to help the community? And what communication tools can grassroots groups that are more effective based on their positioning?
I don't mind taking point.
Go ahead.
The floor is yours, Jose.
Thank you. So I think, similar to what I mentioned earlier, I think what advocates and folks in advocacy spaces often get wrong is that our communities aren't self-determined, right? We don't know what's best for us. We don't have the solutions that we need that are necessary for us to live full, whole, and healthy lives, right? And oftentimes I think people get pitted into their particular issue, right? And one of the things that I think is frustrating, especially for, multi-complex humans, is that we're not single issue people, right? We live at the intersections of a number of different issues, whether it's systemic racism to immigration, to international policy, as well as police brutality, sexual and reproductive health and rights. All of these things are interconnected. And oftentimes what ends up happening is that because advocacy organizations or advocates themselves may have a particular idea of how an issue should and could impact a particular community, they then go forth and implement that strategy or that particular solution, policy solution that may not necessarily resonate with our communities. And so I think that's one component. When we talk about tools, I think one of the things that has been, as we've seen over the course of the last, maybe 3 or 4 years, misinformation has really devastated our communities, right? From, Texas to other states that have large Latinx populations. Misinformation has really been one of the key factors for the outcomes of some of our elections. And so one of the tools that has been used to bring on this misinformation has been WhatsApp. And so how are we utilizing WhatsApp to debunk misinformation, to ensure that our communities get the right information, to develop trusted messengers in communities or surrogates in communities that have the ability to share and debunk information? I think those are some of the key components that allow us to be informed and to also make decisions that will lead to policy changes that are right for us.
Thank you, Angelica.
Yeah, I agree with all that. I think just to add to that, I think sometimes advocates get frustrated that community members don't live in the same, at kind of the same tone of urgency that we might live in. Like we might think, well, if everyone's getting impacted by this issue, why is not everyone lining up to testify against it, right? Or calling their congressional members. And I think that's an unrealistic expectation, because similar to what Jose is saying, like we are multi-issue folks. So you can get and scream in front of the face of someone who's heavily impacted, but what might be on top of their mind right now is how they're going to transport their children to school, right? And so I think really centering ourselves on what does the daily lives of people look like? What are the concerns and frustrations that they have on top of their mind? And then how does that lead to the larger issue at hand that we might be talking about? And then I think, for us at Mi Familia Vota, we're obviously in heavy election season. So we hear all the time right now, like, why doesn't the Latinx community vote? Why don't people care, right? It's like, well, we're still building out our culture of advocacy and celebrating our civic engagement contributions. And so really recognize at the community level and at the individual level, everyone's role is really important, and making sure that we're not accidentally excluding people from our advocacy efforts because we're putting labels by, you have to live in this community, or you have to have been impacted by this, or you have to be a US citizen. You can't be, this is only for non-US citizens. We're really recognizing, again, it's a collective effort. Like advocacy is always going to be a collective effort. It's a long-term game that we're playing, but we need to be celebrating our victories at every single moment. In terms of the communication, yes, WhatsApp, and we've seen a lot of other social media platforms be sources of misinformation. I think we're looking at it from the perspective of, what are we doing to counteract the misinformation that's out there? Are we providing good information, accurate information? Are we contradicting the misinformation that's out there? Or are we just letting it run rampant and people are picking up on it because they're not seeing anything else that would challenge that? So I think that's something that we're keeping in mind. But I think more importantly is the other thing that folks sometimes get wrong is they think that if someone didn't respond positively to, something that we were trying to engage them in, whether it be voting, whether it be, an advocacy campaign, sometimes we think like, oh, that person doesn't care, and therefore, it's an end game. But the reality is people need to be exposed to information over time by multiple people and throughout different sources of information, social media, someone in their family, someone at their school, someone at the clinic that they go to, a poster, a billboard, a radio ad, a TV ad. And so this being part of the advocacy network is really understand the full scope of things. What role are we playing as individuals and as organizations, understanding that it's part of a much larger fabric to make sure that we're bringing equity to, the communities we're serving. And it has to be multilingual, it has to be multicultural, it has to be through different forms, it has to be through art, it has to be more scientific, because we're diverse individuals, right? And so we all need different sources of information to come in different sizes and different languages for us to really grasp onto that. And so it can't be this one blanketed effort in terms of advocacy.
Thank you. Yeah, we are a market within the market, right? We just talked about our race and everything that comes with it. But I wanted to see if there were any questions from the public. I'm going to check the Q&A. Any questions for Jose and Angelica? Okay. If not, please drop in on the chat. Stick around for a little while just to make sure that they answer information. And of course, their contact info will be in the packets that we'll distribute. And so Angelica and Jose, thank you so much for that conversation and demonstrating how impactful and fundamentally valuable it is taking a community-centered approach to building networks by involving individuals. And like I said, at every level of the community. And what I loved, Jose, is what you said, that if we are given the tools, if those become accessible to us, we can solve our own issues, right? We know how to do that. We just need to have access. And so thank you very much for those empowering words. It looks like we are at the end of our event. I am grateful to all our speakers, our participants. I love the opportunity to have been able to MC this program and elevate the work of this amazing lineup of speakers. Thank you all for taking the time to be with us for this conversation today. Let me see, there's a couple of things to share with you. So let's see. So I'm really energized by the national partners and grassroots groups working to build the social and political supports needed for our children and families, but there's still more work to be done. And that's why it is vital that we continue to center the voices of children and families to make sure that all children have access to the resources they deserve. And to continue to create positive change, we need collective power and action from our communities now. We need to show the intersectionality of issues impact children and families. We must continue to advocate to ensure the health, education, and well-being for all children and their families. We're going to go on to the contact and connect slide. So I'm beginning to get a little note that my internet is unstable, so I'll do this quickly. To continue engaging in this conversation and our work, check us out on social media for more events and resources. And let's give one final thank you to our audience for being with us today for this important conversation. We encourage you to get in touch with any questions or collaboration opportunities. Again, we will share the slide deck and to the recording in an email to everybody who registered by Friday this afternoon. The next slide, please. If you thought today's programming was really impactful, I encourage you to register for free for our next upcoming event, the Children's Legislative Agenda, which will take place Thursday, November 3rd, from 10 a.m. to noon Central, which would be 9 to 11 Mountain Time. The summit will present a children's legislative agenda for the 88th Texas Legislative Session. Experts will share research and data along with the policy recommendations to improve the lives of children. My team just, I think, to register in the chat, or you can email anyone on our team for details. So our final slide, before we close out for the day, I have one final request. We encourage you to just take a moment to share your feedback on today's event with us using the QR code on your screen and the link shared by the team in the chat. Gracias a todos, les agradecemos su tiempo y acompañado. Thank you, and we'll see you November 3rd. Have a wonderful day.